Warm welcome to the learners of Ayurveda. ఆయుర్వేద అభిలాషులకి ఆరోగ్య అభిలాషులకి నా హృదయపూర్వక సంక్రాంతి సంబరాల ఆనందోత్సవాల శుభాకాంక్షలు. టుడే in our program we will come to know the importance of Agaru, a most useful, wonderful plant useful in our day-to-day life. In the system of Ayurveda, many medicines are there, is it not? How they are applicable, what is what? Really, in the system of modern medicine, if you want to utilize a medicine, there are so many legal procedures are there to implement its efficacy to serve the suffering humanity. But in the system of Ayurveda, for the past many centuries, these drugs have been transmitted by the scientists like Charaka, Susruta, and famous in Nigantu Koranak, Bhava Prakasha, Dhanvantari Nigantu, etc. etc. Right. Today, lot of procedures are there to implement a drug. In olden days, how they have classified the medicinal plants, on what ground, how they have utilized to serve the mankind is a big issue even today. Today, we are following a lot of clinical applications and clinical legal procedures to release a drug. Is it not? But in the system of Ayurveda, National Medical Council, Indian System Medicine has framed a wonderful and a beautiful syllabus. Based on that, if you are going through the concepts of Ayurveda, you can understand how it is framed, what is what, how far it is applicable to the mankind in serving the suffering humanity. Not only in the preventive aspects but also in the curative aspects. Is it not? Part and parcel of our LN Ayurveda Dryoguna Academy online tuitions. Today we will come to know the importance of the Agaru and their applications in day-to-day life. This plant is raw material everywhere available. It is almost black in color. You can go through it now. See how they have identified botanically. Division Spermatophyta, subdivision Angiospermae, class Dicotyledone, subclass Polypetale, series Cassiflorae, order Mytilles. You go through the characters of all these classical technical terms and go to garden, apply these technical terms, you can identify the medicinal plant, especially Agaru. But in Ayurveda, how it is identified? Loha, Krumija, Yoga, Yogaja, Rajaraha, Anaryaja. So these are the some of the important classical characters to identify this plant. Now, how this plant is classified, let us try to understand. According to Charaka comes under Sita Prashamana Dasemani, Swasakara Dasemani. According to father of surgery, Susruta comes under Yeladigana, Salasaradigana. Right? Okay, you came to know some history, but how to identify this plant? It is an evergreen tree, grows up to 70 feet height, grows in higher altitudes. In all normal belt in sea coast, it is not available. Remember this point. Now, bark is thin, leaves linear, lanceolate, ovovate, oblong. Acute at the base, slightly appressed. Flowers very small, green or every cylinder pedicels, forming a sessile peduncle and arranged laterally from the younger branches. So these are the characters you are supposed to go through when a plant is available as per the subject is concerned. Now period. Period is slightly hairy outside, densely villous inside. Now filaments red at the effects. Ovary tomentose. Fruit is capsule ovovate in shape and slightly compressed. Flowers seen in summer and fruits in rainy season. So let us see what are the different varieties in Viva. In Viva BAMS second phase final examinations, even in Draviguna MD level, they will ask you, even in interviews also, they will ask you what are the different types like Rajanigantu, Krumajagaru, Kastagaru, Dahagaru, Mangalyagaru. Now, what are the part used? Okay, you know how to identify the medicinal plant, especially Agaru. Then which part you have to use? Kandasara, the stem essence we are using. Then Kandasara Taila, the oil obtained from the stem is used. Dose. Kandasara Taila 1 to 5 drops can be used. Kandasara means generally few drops. In case of drops, very few drops we are supposed to use. Now Visishta Yoga, Agarvadi Taila. Visishta Yoga, Agarvadi Taila. This presentation is specially for BAMS second year students. This presentation is especially useful for BAMS second phase students and MD Dravyaguna PG scholars also it is applicable. See, generally people thinks in PG entrance examination what bit comes, what is what. When Agaru plant is given botanical name, family name, Rasaguna Vere Vipaka, and then sometimes even the chemical compounds may be asked, Visishta Yogas may be asked, is it not? Anyone you are supposed to go through it. Now, karma, Sheta Prashamana, Swasakara karma, Twachya, good for, see, you take Agar Churna, good for infections, in all skin infections, this can be taken. And in respiratory distress also, it is applicable. Respiratory artery infections also, Agar Churna with honey is applicable. Even in case of phlegmatic conditions in Kapha Dushti can be used. Now, Doshaharatva. See, Sita Mata, Kapahara, Mata Shamaka. So how apply to see in our day-to-day life how it is applicable? Then what are the different conditions where Agaru is used as an ingredient in different combinations or Agaru independently how this can be used? Is it not? In Kapaja Vikaras 20 you can use it Swasa, Kasa, even in Matranya Vikaras like Netra Vikaras, Dushtavana, even in chronic ulcers this can be used. Krumi worm infections, Swagata Vikaras, Kushta, Swasa, Kasa, Amavata. Right? Let us see how practically it is used in our day-to-day life. Just you take the taila of agaru and apply externally. In case amamata is extremely useful. The same agaru drops, taila drops can be used internally also. See, okay sir, you are telling so many things. Are we having any clinical trials conducted? Any articles are there, or any scientific evidence is there in this plant to use it? Yes. What is the clinical evidence? What is the science? I will define now. Universally acceptable words. What I am telling. When the science is developed, when we entered the 14th century, 15th century, plant anatomy, histology came into picture in olden days. The same subject was there, but at the time, based on the availability of the Sanskrit language, they have mentioned the same language is transmitted now. Universally acceptable Latin language, Greek language is under operation in olden days for the past 14th for the past many centuries, like in the sense 14th century onwards. And when the medical sciences recognized the courses like BAMS, MBBS, etc., pharmacy, B pharmacy, M pharmacy, based on their syllabus, based on their parameter, they used to conduct the clinical trial. But in the system of Ayurveda, based on the classical fundamentals, these have been tried on human beings in olden days, and the same knowledge transmitted we are using. Pratyaksha Pramana, Anumana Pramana, Aptavachana, these are the three important factors to be noted down, especially without any fail. Based on these grounds, only today we are able to identify the medicinal plants. In olden days, based on their experience, as the Sanskrit language available, kept in Sanskrit language. Today, courses are available, different languages are available, especially English language, and medicinal languages are there. MBBS medicinal language there, Ayurveda, Sanskrit technical term, in which we are having technical terms in Ayurveda in such a manner. Even in modern science, they are having the technical terms. Is it not? See, you have to see Ayurveda as Ayurveda, see allopathic medical science as allopathic medical science. You cannot compare. Is it not? The method, the basic principles, the fundamentals sometimes vary. See, the ultimate aim is to serve the suffering humanity only, but parameters are differing. Is it not? The method of learning also differs. You have to note this point, right? Anyhow, even in hiccup also take this churna with madhu and kasa in phlegm. When in case of penis, pratishyaya, swasakasa, vikaras in cold and cough, eosinophilia, asthma, bronchitis, you can take this plant with or with honey, or sometimes Iswari Mula Churna also can be used with Agara Churna. Then Twagata Vikaras, in case of Twagata Vikaras, prepare, you take the Agara Churna, add little bit of warm water and make paste and apply on the skin problems. It is applicable. It is clear to you now. In this episode, you can understand what is Agaru. Agaru practically how it is applicable. Is it not? See, really, if you want still more confirmation about these plants, you refer the books framed by National Council for Indian System of Medicine, seasonal especially Kaideva Nigantu, Bhava Prakash Nigantu, Dhanvantari Nigantu, and Charaka Samhita, Susasam, without referring all these books, whether these plants will work or not, having such type of doubts is not the right way. Go through the books. You go through the books, refer the books, you can understand the concepts. Is not without referring the books, you will have so many doubts. But If you are having referring the books, you will have the medical doubts only. Apply the medical doubts and confirm through the reference books framed by the National Council. We have to say thanks a lot to the National Council for Indian System of Medicine for mentioning the reference books even in 20th century to make the mankind to believe the concepts of Ayurveda. Is it not? Thank you for sparing your valuable time in this episode. You can understand what is Agaru, how to identify Agaru, where it is applicable Agaru. In BAMS second phase, spare much time to go through all the things and comment on me. Dr. Simhadri, Ellen Ayurveda, Draviguna Academy, online tuitions. Our aim is to make Draviguna so easy and this pattern also beneficial in PG entrance exams. Only 6 months time left for the entrance examinations. Generally in the month of June, July it will be their examinations. Is it not? So don't, without wasting the time, just go through the subject regularly. Two classes will be there. Those who are interested for PG entrance examinations can contact us. Dr. Simhadri 9014141722. Thank you for sparing your valuable time. Have a happy Pongal. Thank you.